Nalmefene is used for the emergency treatment of known or suspected opioid overdose. Symptoms of opioid overdose may include unusual sleepiness, difficulty waking up, or breathing problems. Other symptoms may include small, pinpoint pupils, slow heartbeat, or low blood pressure. If someone has serious overdose symptoms but you are not sure if it's due to opioid overdose, give Nalmefene anyway, since lasting slow/shallow breathing may cause permanent damage to the brain or death. Be sure to get medical help right away after giving the first dose of Nalmefene, as symptoms may return after treatment. This medication works by blocking the effects of the opioid in the brain. The recommended dosage is based on the person's response and should be administered by a healthcare professional. When you receive this medication, be sure to read the patient information leaflet and instructions for use provided by your pharmacist. Keep the medication accessible in case it is needed and learn how to properly administer it. If you have any questions, consult your doctor or pharmacist. It's important for close family and household members to know the symptoms of an opioid overdose and how to administer this medication if necessary. Opioid overdose should be treated immediately to prevent serious effects. When using the Nalmefene spray, remove it from the package only when you are ready to use it. Lay the person on their back, tilt their head back, and support their neck. Gently insert the tip of the spray nozzle into one nostril and press the plunger to give the dose. Remove the spray nozzle from the nostril and move the person onto their side. After administering Nalmefene, seek medical help right away, even if the person wakes up. If symptoms return, administer another dose in the other nostril every 2 to 5 minutes, changing nostrils with each dose. Each nasal spray contains only one dose and cannot be reused. Continue to closely watch the person until emergency help arrives. Inform the healthcare professional that you have administered Nalmefene spray. If you experience nasal discomfort, a stuffy nose, headache, nausea, flushing, or dizziness while using Opvee 2.7 mg per actuation nasal spray opioid antagonists, it's important to talk to your doctor or pharmacist. This medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. It's worth noting that many people using this medication do not experience serious side effects. For those who have been using opioids regularly, sudden withdrawal symptoms can occur after using this medication. These symptoms may include body aches, fever, sweating, watering eyes, runny nose, sneezing, goosebumps, yawning, weakness, shivering/trembling, nervousness, restlessness, diarrhea, nausea/vomiting, stomach cramps, increased blood pressure, or fast heartbeat. While rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to remember that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects or report them to Health Canada at 1-866-234-2345. Before using Opvee 2.7 mg per actuation nasal spray opioid antagonists, make sure to inform your healthcare provider about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues. Discuss your medical history with your doctor or pharmacist before using this medication. It's important to inform them about any upcoming surgeries and all the other medications and herbal products you are currently using. If you are pregnant, it's crucial to know that untreated opioid overdose can be harmful to both you and your unborn baby. While Opvee 2.7 mg per actuation nasal spray opioid antagonists may be used during pregnancy, it could cause opioid withdrawal in your baby. Be sure to inform your doctor if you have used this medication so that proper monitoring can be put in place. It's unclear if this medication passes into breast milk, but it's unlikely to harm a nursing infant. However, it's best to consult with your doctor before breastfeeding while using this medication. When taking Opvee nasal spray, it's important to be aware of potential drug interactions that could affect how the medication works or increase your risk for serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without first consulting your doctor for approval. This will help ensure the safe and effective use of Opvee nasal spray. Remember to always follow your doctor's guidance when using medications. If someone has taken too much Opvee and is experiencing severe symptoms like passing out or difficulty breathing, it's crucial to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to act quickly in these situations to ensure proper medical attention is received. It's important to talk to your doctor or pharmacist about how to prevent opioid overdose. Make sure to educate your family members about the signs of an opioid overdose and where you store this medication. This nasal spray is used to reverse the effects of an opioid overdose and should be used as directed by your healthcare provider. It's important to use this medication as soon as an overdose is suspected. The usual dose is 1 spray into one nostril, and then another spray into the other nostril if needed. Be sure to follow the instructions provided by your doctor or pharmacist for the best results. Opvee 2.7 mg per actuation nasal spray is a prescription medication used to treat known or suspected opioid overdose. It works by blocking the effects of opioids in the body to reverse the effects of an overdose. This medication is for use in adults or children who are awake and breathing on their own. The usual dose is 2.7 mg sprayed into one nostril. If the person does not respond after 2 or 3 minutes, a second dose may be given. It is important to seek emergency medical attention after using this medication. Opvee should be used as soon as an opioid overdose is suspected, and it can be administered by anyone, including family members or caregivers. When storing Opvee 2.7 mg per actuation nasal spray opioid antagonists, it's important to keep it in the original package at room temperature, away from light and moisture. Be sure not to freeze it, and avoid storing it in the bathroom. Always keep medications out of reach of children and pets. Be mindful of the expiration date and replace the spray before it expires. When it comes to discarding the medication, do not flush it down the toilet or pour it into a drain unless specifically instructed. Instead, consult your pharmacist or local waste disposal company for proper disposal methods when the medication is expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.